I think, that urology cancer centers have been examined closely by government, by professional organizations. And what I would say to the criticisms would be this. There obviously is a trend towards specialization in medicine, and there's a trend towards specialization in the delivery of care. There are heart hospitals in this country. There are centers, radiation centers that only treat brain tumors. And so I think when you have doctors who get together and who really focus on one thing and want to do it incredibly well, that there cannot be any disadvantage to that. Our goal is to deliver top quality care, state-of-the-art, new equipment, manned by trained professionals who generally care. I mean, how can you be against that? And I'm not over-exaggerating when I say that we've covered every base to try to make sure that the most advanced care, whether it's surgery, robotic prostatectomy, whether it's IMRT radiation, whether it's hormonal treatment, whether it's chemotherapy, we want to make sure that patient gets the latest and best treatment that's available. It's not beyond our ability to refer a patient someplace else. We work with the groups in the area, the medical oncologist and the other groups, to try to ensure that everything is available. We don't want to slam the door on any treatment modality for patients. And I think since we're all in the same group, since I'm the radiation doctor, there's 17 urologists here, we're all on the same page in terms of what we want for the patient. So when I see a patient, if I say he's not a good candidate for radiation, that's coming from the heart, he's not a candidate. If a surgeon sees a patient and feels that surgery is not a good option for them, then that's the way we go. So we discuss this. This is a truly interdisciplinary, multimodality center. We're discussing all the things that are available for patients, sometimes before we even see the patient. Frequently, the urologist will call me or contact me and say, I'm sending a patient to you, here's the difficulties of his case. So we talk about things ahead of time. I think that streamlines the care. It also it makes sure that we've talked ahead about everything so that we can tell the patient at the time of the first visit, these are all the things we need to think about, these are all the things you need to think about and decide about. And that leads to better care, that leads to better outcomes.